take a look at some of the diseases of the urinary system. I did try to keep them to some very common diseases. Again, we're not presenting every and all disease that could potentially happen to the kidneys or the urinary system. However, we're looking at a couple of very common ones here in this particular section. So first up, we have this acute kidney disease. An acute kidney disease is something that happens very quickly. So the term acute means it comes on very suddenly, so breaks down to a short time, and it should go away fairly quickly if treated properly. So acute tells us very short and sudden onset. The second one we're going to take a look at is chronic kidney disease. And chronic refers to anything that is usually about 3 months or 12 weeks or goes longer. This one tends to come on very slowly and ramps up over time. However, it's going to last for a very long time. So I've shown you the same problem with the kidney, and really what it does is that both acute and chronic kidney disease interferes with us being able to produce urine inside the body. Next up, we have the term polycystic kidney disease, and you can see here in this picture that you've got a normal smooth kidney on the left-hand side of the picture, and you've got a polycystic kidney on the right, and it looks like a whole bunch of little sacs or fluids that is built up. Let's try to break down the term polycystic because I think this is going to lead us straight into what this disease really is. Okay, so let's take a moment and break down the term polycystic. Okay, pause the video if you need to. Let's break down the term. Okay, so there is a prefix here, and the prefix here is poly, which means many, much, lots, right? Cysto, okay, refers to a bladder, but it's also really just anything that holds fluid, so a sac might often be a description. And then our IC or ic suffix is pertaining to. So polycystic is really just pertaining to many sacs that hold fluid. So let's take a look at this polycystic kidney again and see if we can sort of recognize that in the picture. Okay, so here we are back at this picture, and again, the normal kidney here is in the left of the picture, and the polycystic one is here on the right. And so what's really happening at the surface of this kidney is they're getting these little fluid-filled bubbles that almost form on the surface of the kidney. Okay, so we call those, right, cysts, and there are many of them. So in fact, they often cover the surface of the kidney. Okay, so sometimes just being able to understand medical terminology and what some of these words break down to is going to lead you to understanding the diseases that you are looking at in a much more comprehensive way. Okay, next up is the term hydronephrosis. And again, I want to break down the term hydronephrosis because it is going to lead you into what this disease really is. Okay, so here is the term hydronephrosis. Again, pause this video if you absolutely need to. Break down the term yourself before we break it down together. Okay, so in the term hydronephrosis, we do not have a prefix. We do, however, have two root terms, hydro and nephro. Okay, hydro refers to water, nephro refers to the kidney itself. The suffix here is the osis, O-S-I-S, portion of the term, which is a condition of, sometimes an abnormal condition of, is how it's defined. So the term hydronephrosis means an abnormal condition of water in the kidney. And in this case, it's not necessarily water, but just urine that has backed up in the kidney. Urine, however, is mostly water, so hydronephrosis, okay, is a good way to describe this. So here is our picture again. So what's happening is that the urine that the kidney is making should go down the ureter and to be stored into the bladder. The bladder is meant to be more balloon-like. It stretches, opens, it closes back up. However, the kidney really isn't a stretchable organ. So if the urine, right, which is again mostly water, okay, builds up inside the kidneys, what's going to happen is it starts to almost balloon out a little bit, which is this picture you're kind of seeing here on the left, and it creates a lot of damage to the kidneys. So hydronephrosis.